Hello everyone. Okay, so you're welcome to this channel. No one is here yet, so I would be waiting on for a while to see people joining before I start. Okay, so actually I was supposed to have this live stream on Saturday, yes, on Saturday, but unfortunately I couldn't have this live stream because of some one or two reasons. So yeah, something came up, so I had to reschedule it. It's rather unfortunate the network is not very favorable here. Oh yeah, so I'm going to be going straight into it. So today we are talking about the comment section. It is what You're welcome once again to my channel. Hello everyone, thank you for joining. Thank you very much. Please double tap on the screen to like this video. Bryson says hi. Hi Bryson, if I'm right with the pronunciation of your name, Bryson, right? Hi. Please double tap on. I'm very sorry, the network is not favorable at all. I'm very sorry. Ada says hello. Hi Ada. Hello, please double tap on the screen to like this video and also subscribe to this channel. Splash says hi. Hello Splash. Hello. Please double tap on the screen to like this video and please subscribe to this channel for more health videos. It's rather unfortunate the network is not very favorable and it has been reconnecting for a while now. But I'm going to be going straight into this so that we can all get to know what this video is about. Okay, so this video is basically going to be on what diabetes is, and I've named this video diabetes 101. 101 simply means basics or fundamentals. Yes, so diabetes fundamentals, what everyone is supposed to know about diabetes. Okay, so I'll be looking at, because I've written some points that I'll be discussing with you this very day. So the first thing is diabetes complex and multi-phased. Multi-phased means that it's a combination of different factors. It is not dependent on only one particular thing. It's not because of only one particular thing that it is caused. And it happens to be that it affects most good care of ourselves, because diabetes affects metabolic disorder that is characterized by high levels of glucose in the blood. And this can be caused by a variety of factors. As I said, it is multi-phased, so it is caused by a variety of factors. And it includes genetics, lifestyle, and it could even be environmental factors as well. So what at all, how does this okay, so from this we have to get to know what insulin is, what pancreas is. So when we look at the anatomy of the human, diabetes is a problem with the insulin, as I explained earlier, that it's associated with high levels of glucose in the bloodstream. And this is the explanation to it. Diabetes is a problem with the insulin, and the insulin is a hormone produced by the pancreas. So if your insulin is able to play its crucial role by regulating your by regulating your glucose level, it means that you are going to be healthy with your glucose level. Your glucose level is going to be on a healthy base. But this is the case if it happens that your insulin is not able to regulate your glucose level as it's supposed to be in a healthy way, this is when diabetes comes to play. Please, I hope you are getting me. Please give me a hi. Let me know whether you are following whatever I'm saying over here. And if you don't get anything, please let me know in the comment section. And please double tap on the screen to like this video, and please subscribe to this channel as well so that you can watch more videos that I bring out. Okay, so there are several factors that can happen for somebody to get diabetes. It could be lifestyle, it could be environmental factors, it could also be genetic. There are there are different ways that someone can get diabetes, and also there are different types of diabetes. And here I'm going to be discussing with you three different types of diabetes. We have type 1 diabetes, we have type 2 diabetes, and we have gestational diabetes. So with the type 1 diabetes, it happens to be an autoimmune diabetes. So autoimmune disease. Yes, it's an autoimmune disease, and it normally happens in childhood. Yes, that's type 1 diabetes. Normally happens in childhood, and it's not caused because of lifestyle, unlike the other type of diabetes I'll be talking about. For type 1 diabetes, it isn't caused by lifestyle. So hello people, fellow, thank you very much for watching this video. Thank you very much for joining. Give me a hi and let me give you a shout out over here. And please double tap on the screen to like this video. Okay, so the next type of diabetes I have here is type 2 diabetes. Type 2 diabetes. And with type 2 diabetes, it happens to be developed in adulthood. Most of the times it happens to be developed in adulthood, and this is when your insulin is unable to make the glucose go be produced, and the energy being used by the cells, it's unable to do that. Hence the glucose happens to stay in your bloodstream, and this can cause diabetes to occur. Please, I hope you are getting me. Yes, so that's one thing about type 2 diabetes, and it's normally due to lifestyle factors, environmental factors, and also could be genetics. The next point, or the next diabetes type I have here, is gestational diabetes. Gestational diabetes. And with gestational diabetes, it normally happens during pregnancy, because during pregnancy you normally experience hormonal changes, and this can also cause gestational diabetes. And one thing is, can go it goes after delivery. Gestational diabetes goes after delivery, but the part is that normally women who experience gestational diabetes can further develop type 2 diabetes. Type 2 diabetes. Yes. And please, with this video is for just educational purpose and not to diagnose anyone of any disease. It's just for educational purpose. So Effie says, I don't really know, but hi Effie, hi. Please, I hope you are good. Please give this video a like by double tapping on the screen, and also subscribe to this channel for more health tips, educational health tips. Okay, so now we are going to be talking about certain symptoms of diabetes. Yeah, even though the symptoms might not be the same for the types of diabetes, but most at times they happen to be common symptoms that those types happen to share. So we are going to be discussing some of these symptoms of diabetes. Okay, so the first symptom we'll be talking about is increased thirst and hunger. Increased thirst and hunger. Yeah, so most of the times those who happen to experience those who happen to get diabetes, one symptom is increased thirst and hunger, because the glucose level is built up in the bloodstream. Hence, your body has to get a way to flush that glucose out by making you urinate more. And urinating more is going to lead to dehydration, right? So that is how it happens to make you get increased thirst. Please, I hope you are getting me. The next point is frequent urination. As I mentioned earlier, frequent urination. So you are urinating frequently, and what is going to happen? you are urinating frequently. So as I said earlier, because of the glucose built up in the bloodstream, it has to be flushed out. So you are going to experience multiple trips at the bathroom. That's what I'm trying to say over here. Okay, so the next point I have here is fatigue. Very true. Normally, one symptom of one symptom of diabetes in general is fatigue. Yes, fatigue. And I have a video on my channel about early morning diabetes. Early morning diabetes symptoms. Yes, so you can check that out. Okay. The next point is blurred vision. This is very true, blurred vision, because it happens to be that they are unable to see very well because the lens of their eyes happen to be swelled. That is one symptom of diabetes, blurred vision. The next point is slowed healing of cut and wound. This is very true because the nerves that happen to help you get your cut wound healed easily happen to be damaged, and as a result of that, you are unable to get your wounds that are cut easily healed. That is one point over here. And the next point is tingling and numbness of feet. Tingling and numbness of feet. This is also one very point over here. And one thing is, if all these are left untreated, if all these are left untreated, diabetes can actually cause serious health complications if it is left untreated. So let's look at certain health complications that can be as a result of diabetes symptoms left untreated. So the first I have here is heart disease, because the sugar levels can damage your blood vessels and nerves, and this can increase your risk of getting heart disease. Um, Osh says hi. Okay, so the topic is we are talking about diabetes. Diabetes. Please, I hope I got your name right. Osh, right? Okay, so you're talking about diabetes fundamentals, and this is for educational purpose and not to diagnose anyone. So please double tap on the screen to like this video and also subscribe to this channel. Ush. Please, am I right? Is it Esh or Ush? I don't really know whether I'm pronouncing the name very right here. But thank you very much for giving this video a like, and please also subscribe to this channel so that anytime I bring out or I drop a video, you can see it. Okay, so as I was saying earlier, as I was saying earlier, as I was saying earlier, if diabetes is left untreated, it can result in different health complications like heart disease and kidney disease. The next point I have here is if it is left untreated, it can result in vision loss, which is very true because I said earlier in the symptoms I said earlier that one of the symptoms is Osh says he lost his grandma to diabetes. Hates the sound of that. Oh, that's very sad. May her soul rest in perfect peace. That's very sad. That's why we all have to know much about. That's why we have to know much about this particular disease, because it happens to affect a lot of people, and most of the time some people don't even know much about the symptoms. That's why we have to know much about that. Okay, so the next I have here is nerve damage. Nerve damage. Okay, yeah, so any cure so far? It happens to be that, someone is asking a question over here. Ash is asking a question: is there any cure so far? Any cure? I've not really heard of cure, but then it is able to be managed. You can manage it with certain treatment, and I'll be be touching on that very soon with the treatment and others. Okay, so the next is foot damage and amputation. So if diabetes is left uncured, it can result in foot damage. That's also one point. So now let's talk about how we can treat it. Treating. So how we are going to manage it just in case someone happens to have diabetes. How are they going to manage it? So the first point I have here is insulin therapy. So with insulin therapy, it deals with injection of the insulin into yourself by yourself. Yes, you inject it so that you can get your blood sugar levels on a healthy line. The next one I have here is oral medication. So your doctor is going to prescribe drugs for you that you're going to be taking probably orally so that you can have your diabetes level or your glucose level on point in a healthy line. The next point I have here is lifestyle changes. So you have to okay, so Ush says that it did to my grandma the foot thing. She had an injury that refused to heal. Yes, that's very true. Yes. Thank you very much for engaging in this conversation, Ush. Thank you very much. Thank you very much. It's very true. One of the symptoms is the tingling of the foot, and normally wounds are unable to heal. That is very true. Thank you very much for engaging in this conversation. So, what then? Apart from these treatments, there are other stuffs that you can do to manage diabetes. So you can be monitoring your blood glucose level regularly. So when I started my first day internship at a pharmacy, I realized that most people do very well because they are very able to come to the pharmacy on their own to check their blood glucose level, which is very good. Yes, to me, I see it's very good because it's very good to be aware of your blood glucose level. It's very good. So I would advise each and everyone to be checking their blood glucose level anytime they get the opportunity to do so that you be aware of certain things that is going on in your body. Okay, so the next point I have over here is when you are able to monitor your blood glucose level, these are some of the benefits you can see. You get to see how different foods and activity affect your blood levels. So let's say you ate a certain particular food and you happen to check your blood glucose level. You are going to get to know what exactly the food you ate exactly that morning after you check your glucose level. Has it been dropped? Has it increased, or is it in where it's supposed to be? Is it healthy? You're going to get to know. And you are also able to identify patterns and trends in your blood sugar levels when you normally monitor by checking your glucose level. The next point is you make adjustment to your diet and exercise routine to keep your blood glucose level under control. So what are the possible preventions? This is a question. What are the possible preventions? Like what causes diabetes? Is it inheritable? Okay, so thank you for this question. So one way you can prevent it if you don't have it is to be careful with your lifestyle. Be careful with the food you eat. Make sure whatever you are eating, I'm not saying don't eat anything having sugar, that might even drop your sugar level, but moderate the rate at which you eat sugary foods. Please, I hope you are getting me. So that's one prevention. And also, one thing you can do is you can be checking your blood glucose level regularly so that you get to know if anything is wrong. You can be checking regularly, and it can be actually through taking through genetics, yes. But then if you are able to take good care of yourself, it's not going to be inherited or something. Yes. So you can prevent it by modification of lifestyle. That's one way you can prevent it. And also monitor your glucose level every time, most times, so that you can get to know what is happening. And exercise regularly. This is very important. Exercise regularly and make sure you are not living a sedentary lifestyle. You are always sleeping, you are not moving yourself up and down. You are just always in the house. You're not really doing much. Be very careful. And I have a video on my channel about early morning diabetes. You can check that out as well. Thank you very much for liking this video, and please don't forget to subscribe to this channel for more videos. So moving on, moving on. Which says sounds like one has not necessarily being a tourist. Well, okay, so yes, so as I said, you have to be checking your glucose level regularly to help you know what exactly is going on in your body. Okay, so the next point I have here is that get enough sleep and manage stress. Yes, get enough sleep and manage stress. This is very important. It is very important. Got many questions to ask. Hope you don't mind. Oh, I don't mind. But I'll be ending this live stream very soon. So I have my social media handles over on my YouTube channel. You can go there to just tap on any of them and we can talk from there. But I don't know if I should add my email address. Yeah, so I'll be adding. So I'm sorry, the internet is not very strong here. So let me know whether I should add my email address so that we can communicate from there. Okay, so what's the next point I have here is manage stress. Managing stress. This is very important. Don't get yourself so stressed out. No. Sleep when you have to sleep. Wake up when you have to wake up at the right time. And when you are able to sleep, when you deprive yourself of sleep, it can raise your blood levels, it can raise your blood sugar levels. That's one thing. And it can also weaken your immune system, and it can increase inflammation and related health issues. The next thing I have here is avoiding smoking and excessive alcohol consumption. Yes, it is very important. Okay, so basically that will be it for today's video. I hope you found this video very helpful. Please give this video a like if you found it helpful, and also subscribe to this channel for more health tips. All right, bye bye. And